Hi, and welcome to my channel. Thank you so much for being here. Let's dive straight in. Your first therapy appointment. Oh boy. I've been to 5 therapists in the past 5 years, and that's not even all the therapists I've been to. So I've had my fair share of first appointments. And let me tell you, they're the worst. They are the absolute worst. But first, before you even go to therapy, you may, I'm just warning you right now, you may have a crap ton of paperwork to do. I'm sorry. It is not fun paperwork. It is, but it, you know, they need it to try to get to know you before they get to know you. This paperwork can cover your past, your present, your future goals with your mental wellness. Brush up on your family health history. Make sure you have the dates of any like surgeries or the names of different physicians that have treated you in the past. Yeah, it covers your mental health, your physical health. You know, they're just trying to get an overall picture of you. The questions on your pre-visit paperwork may include things like employment history, relationship status, level of education, past diagnoses, what is the plural for diagnosis? I have no idea. Medications that you take or have taken in the past. You'll want to disclose that kind of information. And they'll also have like a long list of symptoms for you to check yes, no, blah, blah, blah. You know, like, have you ever been sad? Are you often tired? Do you eat too much when you're stressed? Stuff like that, like, you know, just rude questions. just overly personal stuff. Yeah, they get straight into it. Like, fill this out and we'll read it before we even meet you so we can, you know, judge you accordingly. It's not really like that, but it's also really like that. At the end of your paperwork, it will almost always include a notes or a comments, concerns, questions section for you. And in this, I like to put any diagnoses, anything that I think I might have, any mental illnesses that I think I might have. I did this with my borderline personality disorder. I went and researched it, and it was me. I was reading it and going, that is Keisha. And so I took it to my psychiatrist and I said, hey, I think I have this. Can we explore that? And lo and behold, my diagnosis. In this final section, I also like to include any hospitalizations that I've had for my mental health. Also any isolated circumstances, such as if I'm pregnant, or you know, things like you're pregnant, you're homeless, you are in a bad relationship that you can't get out of, you know, things just to mention, because the therapist, the mental health professional that you're seeing will have access to different state and regional sort of programs that can help with different crises. So it's always good to put down where you're really at so that they can do their best to help you, because that is their profession, is to help people. So let them. And now, after sometimes months of waiting, if you didn't have to wait months for your therapy appointment, you are very lucky. Well done. You often have to wait months, though, to see a therapist, which is absolutely ridiculous and a whole different argument. But after months or weeks or whatever amount of time you've had to wait to get in to see this therapist, this counselor, this psychologist, this psychiatrist, you're there. You're sitting in a waiting room, and you're starting to second guess what you wore, and you're starting to look at everyone else around you and starting to compare yourself and going, well, that person is obviously crazy and that person looks really normal. I wonder if they're just here with someone or if they're actually being seen. And do I look like this crazy person? Or do I look like this super normal person? Where am I on the spectrum of crazy? And oh my goodness, should I even be in therapy? I'm not that bad. I mean, I'm okay. I can deal with this, right? Maybe I should just go. They'll never know I was here. And then your name is called. And I welcome you to the most honest hour of your life. And I do encourage you to actually be honest with your therapist. I understand, you know, fibbing on a few things with your therapist. I get it. I really, really get it. I understand not wanting to be hospitalized. And so you just sort of tweak the truth a little bit so that you stay out of the hospital. I get it, but I do urge you to be as honest as you possibly can with your therapist, because that is the best way that they can help you. If you're being honest, they can do stuff for you, you know, they can make improvements with you, and that's the goal here, right? To improve yourself, so do your best. But this is like an awkward first date. This is like, not even awkward, this is like a weird first date. Think of it as a really weird first date. You know, your date is sitting across from you, you're having drinks or something. I don't know, what do people do on dates anymore? But you're sitting with this person and they say, so what was growing up like for you? You know, did you have a really good childhood? What kind of house did you live in? Did your parents work? Did they pay attention to you? Oh, and were you possibly molested as a child? We're just diving straight in, aren't we? While you will likely start talking about a lot of your past trauma and present difficulties that you are dealing with, you probably won't have to dive into those too deep, because they are just trying to get an overall picture of what they're dealing with. You know, you'll work on those things later, but do they need to work on your present situation now, or should they dive straight into your past so that they can work stuff out there? You know, what needs to be addressed? It's all scheduling, it's all a get to know you session. It's like a weird speed dating thing, right? Just as much as you can do in an hour. That's your first therapy appointment. It's as much as you can get out there in your allotted hour. But ultimately, in the end, it's all just a test of compatibility. Can you talk openly with this person? Can you laugh with this person? Can you cry? Can you improve yourself with this person? Are they going to be able to help you? And if the answer is yes, congratulations, you found your therapist. If the answer is no, which is fine, yes, you waited months to see this person, yes, you did all that paperwork or whatever, and you got to this appointment and it's just not a good fit, see someone else. It is worth finding the right professional for your mental health. You know, it's the same as any other illness, any other ailment. You want to find the right doctor, okay? So if it's not the right one, there are many others in the sea. Try a guy instead of girl. They've all got different approaches to mental wellness, and maybe you just need someone with a different approach. It is worth finding out. It is worth finding the right therapist. And as a quick note, if you are like a teenager who has to go to therapy, whose parents are taking you to therapy, look, I've been there. And I hated my therapist, and all I did was play mental stupid mind games with my therapist until he was so sick of me and my parents were done with my therapy appointments that I just felt like, I win. Do you know what? I didn't win. I lost an opportunity to improve myself when I was in my teen years, and now I'm having to work out all that crap now. Okay? It is worth making the time to work on yourself. And if your parents got you a crummy therapist, do you know what? Tell your parents, I don't like this therapist. Can we try someone else? Because it's worth trying someone else. But use your time. It's your time. It is confidential. It's your therapist. Sorry. Make the time worth it. Just because you're not paying for it doesn't mean it's not your appointment. Make it worth your time. Oh, I wish I had. I so regret not using my time better. I really regret not changing my therapist when I had the chance to have therapy, because I didn't have a lot of opportunities for that as a teenager, because my parents were they didn't know how to help me. That's what it really comes down to. They wanted to help so much. And if your parents are out there trying to help you get better, be so grateful. My parents wanted me to get better too. I didn't make good use of the time that they gave me to do that, and I regret it now. So that is my little tidbit, if that is your situation. But thank you for being here today. good luck with your therapy appointment, or whatever your situation is. Good luck. And please like this video, share it. Let's spread awareness as always and help whoever may need help out there. And do subscribe for more mental wellness videos. And I will see you next time. Bye.